How is inflammation felt in the body?
A lot of different ways. Joint pain, intestinal problems, brain fog, depression.
What would you say are the cornerstones of an inflamed lifestyle?
We really have to start treating food as medicine, and that's probably the first thing. There's a lot of different foods that are anti-inflammatory, but then even more so, there's foods that are really inflammatory. The most common overall, in a general standpoint, is dairy and gluten. And then obviously there's sugar. Insulin surges and all that stuff cause a lot of inflammatory problems and issues too.
How to stimulate the vagal nerve?
A lot of different ways that you can do that. One is gargling aggressively for 2 to 3 minutes. If you're gargling aggressive enough that you produce tears, you're stimulating the vagal nuclei, which is interesting. One of the most common things that people, it sounds weird, but they love long-term is coffee enemas.
Yeah, people are obsessed with those.
Yeah. The coffee enema, it will stimulate nicotinic receptors in the colon, and then it fires back up to the frontal cortex. It's probably one of the most effective things that we do with our patients to get the vagal nuclei to fire. Blood sugar levels are one of the most important things that we can do to improve our overall health. If we can just get our glucose to stabilize between 80 to 130, we're rocking and rolling and inflammation is down.
Dr. Josh Red, what's going on, man? Welcome.
Thanks for having me.
It's nice to meet you.
Great. Yeah, nice to meet you. Heard a lot of great things.
Thanks, dude. Thanks for coming out. I'm very excited. Your book is beautiful.
Yeah, thank you.
I was perusing it. I haven't made any of the recipes yet, but they look delicious.
Yeah, we're excited about this. It's going to be great.
Is this your first book?
I had kind of like a prequel that I just published myself and with a partner of mine, Carlin Call, and then we just completely redid it all. And so rewrote it, added 90 pages, added 45 more recipes, and yeah, there it is.
Dude, it's awesome.
Yeah.
Well, I love the focus on inflammation, which is, kind of a buzz term these days being thrown around in the wellness world, and probably by a lot of people that don't fully understand the implications of what inflammation is, its impact on the body. So let's just jump right in. What is the relationship between inflammation and aging and disease?
Yeah, so inflammation single-handedly causing more disease in this country than anything else. And you're right where it is loosely termed. But in reality, I see with my 10 clinics probably 350 patients a day. And we see patients from all over the world that are suffering from severe chronic conditions. And in reality, when they come to us, we look at a bunch of other physiological imbalances, but what we're really getting to is what's causing inflammation. Do they have inflammation? What's triggering it, what's causing it, and how can we get it to calm down? And from there, we'll have a patient go from 0 to 5 good days a month to 20 to 25 good days a month just by addressing inflammation. It's that simple. They could be suffering from a variety of different conditions and problems, and it really stems to just inflammation.
How is inflammation felt in the body? Or is it felt?
Yeah, I think a lot of different ways. Joint pain, intestinal problems, brain fog, depression. Like the way we're treating depression right now is if you have a decreased neurotransmitter, you just replace it. And that's old school, right? Now we're seeing that if you have brain inflammation, then it decreases all neurotransmitters and causes tons of problems. So even depression, fatigue, anxiety, restlessness, neurobehavioral issues, it's felt in a ton of different ways. But in reality, it's probably one of the most neglected things. And the worst thing is when it comes to our kids. Like you'll have kids with neurobehavioral disorders and neurobehavioral delays and a ton of different problems, and they're not functioning. They're failing in school, all these different issues, and yet they just live this inflamed lifestyle that's just jacking them up, right? Their brain's not able to develop properly, and then they just have more problems. And here we are.
What would you say are the cornerstones of an inflamed lifestyle?
Food's one, right? I mean, our food really impacts everything that we do, from inflammation to our biochemistry. Everything that we eat has a significant impact with our immune system, blood sugar imbalances, cortisol defects, hormones, you name it. So we really have to start treating food as medicine, and that's probably the first thing. From there, you have different dietary and lifestyle things that will trigger it as well, on top of some environmental things as well too.
Yeah. How do you measure it? I mean, I think many people are probably familiar with like CRP, but most probably don't, myself included. I don't even really know what that is. It's like it reflects inflammation in the body, but it's like not super specific is my understanding of it.
Yeah, I mean, you have C-reactive protein, which is probably the most common one, which is an acute phase reactant. And when that's high, you have higher inflammation. It can also dictate whether you have an increased risk for cardiovascular event or whatnot too. But there's other markers like homocysteine, lactate dehydrogenase, uric acid, even ferritin. Like ferritin's one for iron, but if ferritin is too high, it can be due to inflammation. So there's a number of different really easy inflammatory markers that we can test in the labs, and if they come back high, then you have it.
Wow. So getting to food, which is where the rubber meets the road when it comes to diet, which is my favorite topic to talk about.
Yeah.
Are there any foods that you believe are truly anti-inflammatory, or is it more about like the dietary pattern as a whole?
That's a good question. I think there's a lot of different foods that are anti-inflammatory, but then even more so, there's foods that are really inflammatory, right? And because we see so many patients within our clinics, we're able to like retest. We kind of have our own research in-house. And so we can kind of see which is the most inflammatory food, which isn't. And our patient population, the most common foods, do you want to guess? Just from you. Let's hear.
Okay, yeah.
Like with our patient population, we deal with autoimmune conditions. We deal with, severe chronic diseases. What do you think the most common foods are that exacerbate their symptoms?
Damn. Well, let me. Gluten, maybe.
Yeah.
Gluten.
Gluten's hands down the worst one. And then the second one is dairy, and then sugar. And obviously there's kind of a difference between conventional dairy and whole milk and things like that, but mainly just conventional dairy that really jacks up our patients. And with research, it shows that the casein protein, which is the dairy protein, it mimics the gluten protein pretty similarly, and so our immune system gets confused, and those two are kind of go hand in hand to being some of the most common inflammatory triggers for our patients.
Whoa, and it's probably different from person to person.
100%, yeah, and that's kind of the big goal for us is we want to address what their specific inflammatory foods are versus the next patient. Everyone has a little bit different foods that they react to for some reason or another. But the most common overall, in a general standpoint, is dairy and gluten. And then obviously there's sugar. Insulin surges and all that stuff cause a lot of inflammatory problems and issues too. But those three are probably the top that we see.
Are you at all familiar with like the A2 casein protein research, like A2 versus A1?
A little bit. Tell me about it.
No, I mean,
you don't know much about it?
Well, I know like I have a cursory level understanding. Basically, my understanding is that at some point, cows are man-made, like domesticated creations, right?
Yeah.
But even among cows at a certain point in their lineage, we bred this new form of casein protein, which is one of the two proteins in dairy. There's whey and there's casein. Yeah. And A1, this is a I think it's currently a hypothesis, so it hasn't been proven or anything like that. But that for many people, A1, which is the primary type of dairy casein protein that we get, like in the modern food supply, is for many people a challenge. So then there's now on the market, there are a number of like dairy producers that have put forth
like an
this
A2
or A2, which is like the ancestral dairy. So I don't know.
That makes sense. I mean, from a gluten protein standpoint, we do the exact same thing with gluten, where there's a ton of different gluten grains that we could use, but we typically in our country only use a few. And those are the ones that withstand the environment and pests and all that, right? And so because we're only using those exact same grains over and over, and we're not getting that variability, our immune system is becoming a lot more reactive to those specific strands than anything else. If we used a variety of strands, we wouldn't be as immune reactive, but now we only use two, and we've only done that for the last 20 to 30 years, and now our population is getting more reactive to that. Let alone we obviously spray it with glyphosate. We take out the fiber, take out the protein, add sugar, add folic acid, do all these other things to make it last 30 years on the shelf that make it way more inflammatory. But
But clinically, like you see when people remove it, they do better.
Way better. Yeah.
Wow. Interesting.
Like not even close. And that's where, sometimes we'll typically do a food intolerance test, but there's sometimes we don't. And if we just have them remove, dairy and gluten and sugar, stabilize their glucose levels, that's a huge change for them.
Wow. Is there a pro-inflammatory villain that you think is overblamed, that people think in the zeitgeist is like very inflammatory, but maybe we're looking in the wrong.
I've never been asked that question.
Yeah,
It's a great question.
In the wrong direction.
I don't. Right now there's a lot of things with like food dyes, which I don't like. There's a lot of things with just our processed foods and things like that. And different environmental things. Like we'll have patients that are super OCD with like what they expose themselves with, all this stuff as well. We've found that the biggest changes that people make is more with diet. It kind of like lowers their toxic burden, their inflammatory load. And then they'll be able to be like more resilient when they're around other things, right? We have severe enough patients where they have to be super cautious with their environment, with like every single little ingredient, and be super OCD. But for the most part, if you can get your inflammatory load down, you can expose yourself to those areas and not really have many problems, you know?
Yeah.
So there's like some people that are overcautious with environmental toxins, and that's awesome. If you can get to this next level from a health standpoint and improve that, then great. But it really boils down to if you can decrease your inflammatory load just with diet, you're going to be able to be a lot more sustainable with other things outside of that.
Yeah, it makes sense. How do you suggest that people start experimenting with these sort of anti-inflammatory exclusionary approaches without sliding into food fear?
Yeah, that's a great question. Like in our book, if somebody is really sick, like a lot of our patients have anywhere from 0 to 5 good days a month. Like their quality of life is really poor. They've been to 20 different doctors. Nobody knows what the heck to do with them. They're giving pills for symptoms and they're just struggling big time, right? Mm-hmm. And so a lot of our patients, they're in like a severe inflammatory state. And so what we'll do is for the first 30 days, we'll have them avoid inflammatory foods. So this is a lot. Like I'll just tell you what you can eat. Proteins, nuts, seeds, beans, peas, vegetables, fruits, pretty much just that's all you can eat. Like real food, right? When it comes to corn, rice, eggs, dairy, gluten, sugar, they avoid that for 30 days. Once things are functioning and inflammation is down, they can add a food back in like once every 3 to 5 days and test it and see how they feel. Typically, for the most part, like they'll react if that food is specific, inflammatory to them. And then they can continue to add foods back in slowly but surely from there. But the biggest thing is, for the most part, once inflammation's calmed down, a lot of our patients don't really react to many foods. They might have like 1 or 2 foods that just don't make them feel well. But for the most part, if they go through this process, I don't think they'll get to a point where it's like, hey, I know my exact foods that make me feel like garbage. And you don't have to be worried about this, what you're going to eat and all this stuff, right? Which I think is a common thing that we struggle with, especially as influencers. And you look at all the different influencers where one says one thing, one says the next thing, and we have people that are actually listening to them like, I can't even eat. I can't even like be in a bubble. I need to jump in a bubble, but the bubble is made of plastic and it has BPA, and I can't even be in that thing.
Dude, it's crazy. When did it become normal to take nutrition advice from influencers screaming in supermarkets? Like anointing foods either approved or forbidden, It's just like so crazy to me that's become the new normal.
It's funny.
And, oh my God.
And then you have patients who are so fearful. And in reality, like we try to simplify that for you in this book where, hey, here's a plan. Avoid inflammatory foods initially. Add foods back in slowly but surely, and listen to your body because everyone's different. And then by the time you're done, there might be a food or two that hey, every time I eat that, I get a headache or I get bloating or I get joint pain or whatever. I'm just going to avoid that. We obviously want to eat foods that are nice back to us, right?
Yeah.
But when it comes to the influencers, it is kind of funny because we'll have some patients come in that are so fearful and worried and concerned about, I can't really do anything. I mean, they're like, 1, they're on 100 supplements. And then 2, their diet is so limited that it's actually destroying the gut microbiome, and it's causing a ton of problems just because they don't have the mixture and variety of vegetables and everything there. And so now they have their main immune system, which is in the gut, is not functioning well, and they're sick because of, what they're trying to do from all the people they listen to, essentially.
Yeah. What I hate the most is when influencers take it upon themselves to either approve or banish certain foods. Like
Totally.
this food is so-and-so approved. It's like, who the hell are you?
It's so true.
You know?
Yeah, and even for me, like My biggest goal is to teach you, educate you, show you what to do and what not to do, but in turn, listen to your body, and what's good for you might be completely different for even your sister or your friend or for whoever. Like, we each have different physiological biochemistries, and we each adapt differently. We each have a different form of resilience, and so we can withstand something different that maybe our friend can't or whatever, right?
Yeah. So. Now, and also, it's not necessarily even a forever prescription, right, to exclude certain foods that might actually, in fact, be triggering you acutely in the moment. Like, I'm not a gut health expert, but what I've gleaned from conversations with other experts is that, like, sometimes a sensitivity might be due to, something gone awry in the gut, like intestinal permeability and whatnot, and you heal that situation, and you could begin to even integrate those foods back in, the foods that you might be sensitive to in that sort of gut dysbiotic context.
1,000%. When somebody is really sick, has intestinal permeability, poor digestion, poor absorption, poor gut microbiome, let's say decreased HCl, decreased digestive enzymes, they're going to react to foods way differently than somebody who has all that stuff corrected and improved, right? And in reality, if we develop the proper HCl and digestive enzymes, they'll break down our food proteins into single amino acids, and our immune system can't react to a single amino acid. So, I mean, check that out. So the only time our immune system can react to food proteins is when those amino acids are strung together.
In peptides, right? When they're not fully broken down.
Exactly, when they're not fully broken down. So you think about it, if I can help my patients digest their food, then they shouldn't react to any foods whatsoever. Their immune resilience will be significantly better and heightened than what it would be otherwise. So you're exactly right. There's a lot of our patients that you can get to improve their overall physiology, and then they're able to eat the foods that would flare them up significantly 6 months earlier, because now their body's functioning at a lot higher level.
So interesting.
We might have a patient with 15 food intolerances right now, and then in 6 months have a list of maybe one.
Wow.
Just by improving your overall physiology.
When it comes to digestion, are you a fan of supplements like digestive enzyme supplements and betaine HCl? Like, I don't really, I'm not at all versed in the like literature on them, but I have them in my cupboard, and I take them just because mentally, like, it makes sense. Like, I'm taking a bunch of enzymes concurrent with like a meal. So
yeah.
And typically, like, as an anecdote, but like, I feel better when I take them, especially if I'm eating like a big, heavy, fatty meal. Like, if I'm going out to a restaurant with my brothers and we know that we're just gonna like pig out. I take like a handful of enzymes and HCl, and I feel generally, I think, better.
Yeah, I love digestive enzymes because you're just aiding in helping those food proteins break down, right? So you're minimizing the workload that your body will have to do, especially if we're eating inflammatory foods. What I like to do even better, though, is to get to the mechanism of why they don't have the proper digestive enzymes functioning, right? A lot of people don't know, and a lot of like health practitioners out there, they'll see a lot of chronic severe cases, and they'll work with the stomach, the liver, the hormones, the blood sugar levels, but they completely neglect the brain. And this is kind of an interesting thing. Your brain, when it fires properly, it fires down to the vagal nuclei and then back down to the stomach and intestinal tract. And it actually increases the amount of digestive enzymes that your body produces. It increases HCl, it increases blood flow to the gut, gut motility, all that stuff. So there's a lot of times someone might have brain inflammation and it's not firing to the intestinal tract, and then they have super low digestive enzymes. They can't break down their food. They develop food intolerances, and then we have lots of problems from there. So I love, just from a health standpoint, taking digestive enzymes and betaine HCl and things like that. That doesn't like hurt anybody, right? But if that person's brain isn't firing properly, then they're going to have all those low levels just from their brain not firing properly. And all you have to do is just stimulate the frontal cortex to get it to fire, and there you go. You actually fix the mechanism. But you'll see a lot of really, really sick people who are on a ton of different supplements, doing a lot of different things, and the mechanism, which is the brain, isn't ever addressed. And as soon as they come off of it, it's like they spiral downhill again. Right.
Whoa. So, I mean, you mentioned vagal, like the vagal nerve.
Yeah.
Is that, I know in the book I saw you have a whole section on how to stimulate the vagal nerve.
Yeah. Yeah. So a lot of different ways that you can do that. One is gargling aggressively for 2 to 3 minutes. you can stimulate the vagal nuclei. I have a hilarious story, by the way. So I had a patient just recently. She was constipated, and she was a new patient. And we had her start the anti-inflammatory diet and some supplements to help improve some things. And she's like, Dr. Red, I'm constipated. And I was like, okay, well, she's like, can I take anything to help with the constipation? And I said, well, how about we do this? Just gargle water aggressively for 2 to 3 minutes every hour until you go to bed. It was like at 5 p.m. And she's like, okay, I'll do that. And all of a sudden I got a text, Dr. Red, I pooed. But just by, doing that stimulates the vagal nuclei and then stimulates blood flow to the gut and will help gut motility and all that stuff. And it works. Just gargling water aggressively for 2 to 3 minutes. Some other things that you can do are like...
That's crazy, by the way.
Yeah. It's cool stuff. And when I say gargle aggressively, you want to gargle aggressively to the point that you produce tears, because the salivatory nuclei is on the same part of the midbrain as the vagal nuclei. And so if you're gargling aggressive enough that you produce tears, you know that you're stimulating the vagal nuclei, which is interesting.
What should you gargle with?
Just water.
Just water.
Yeah, you just get water, gargle as aggressively as you can for 2 to 3 minutes, and there you go. It stimulates the vagal nuclei.
That's
cool,
insane.
Right? Yeah.
I kind of chuckled a little bit because I read it in your book that gagging is another way to stimulate the vagal nerve, and I was like, that's going to be weaponized by the fellas.
Exactly. Exactly. But they can get tongue blades on Amazon and gag themselves. They'll be at a stoplight and just say, hey, pull your tongue blade out and just gag yourself for 10 times. Then you can, once it turns green, you go. If you're watching a movie, you can just gag yourself.
Yeah, and also it's if you happen to have a girlfriend or it's you can use that in your to your benefit. I'm not gonna expand on that, but fascinating. I never would have thought gargling, gagging.
Deep breathing exercises. The one that's
gagging's very uncomfortable.
Yeah, gagging. Look, there's a lot of other things that you could do besides gagging. One of the most common things that people, it sounds weird, but they love long term is coffee enemas.
People are obsessed with those.
Yeah. So the coffee enema, it will stimulate nicotinic receptors in the colon, and then it fires back up to the frontal cortex. It's probably one of the most effective things that we do with our patients to get the vagal nuclei to fire.
But there's a lot of pushback to them. I've seen on social media, like a lot will claim that coffee enemas are like you're drinking your coffee the wrong way. That it's like this, new age woo.
Yeah, there's tons and tons of research. And at the same time, here's where we kind of differ from everyone. Because we have such a huge patient population, we can look to see what the research says, and then we can apply the research. And if it works, we're rocking, right? There's a lot of times we'll actually apply the research, and it doesn't work at all. It's absolute bogus. But that's what kind of separates us from other people is because we can look at the research, apply it. I can show a text to all of our doctors, hey, start doing this and report back to me to see if it works. And then within a few weeks, I'll get texts of, yes, this works, or nothing, So when it comes to coffee enemas, we see that it really effectively helps them. It also helps with detoxification, phases 1 and 2 of biotransformation. It does a number of other things. And so if it's done the right way, it can significantly, help with that anti-inflammatory cholinergic pathway that we talked about, just getting the vagal nuclei to fire and all that as well.
Are there risks?
If you get coffee that's full of mold and all that stuff, I'm sure there is, but we haven't had any patients that have had issues doing coffee enemas, which is, for the most part, once a person starts doing coffee enemas, they'll be like, I love that. Like,
really?
Yeah.
I know both men and women. Like I have a male friend who swears by them.
Yeah.
And then I know some females who swear by them. Very interesting.
It's awesome. We'll have people that have severe gut issues for a prolonged period of time that will start doing coffee enemas on a consistent basis. And then all of a sudden, after having bowel issues for 20 years, not have any moving forward,
What kind of coffee?
We get like the organic, mold-free coffee. There's a ton of different coffee that you can use. Oftentimes, what I like to do is go to Starbucks and get my favorite flavor, and then use that. No, I'm teasing.
I was gonna say,
but you're like, what the heck? No, you want organic, mold-free. That's important.
Right.
There's a device called the Alpha Stim that you can clip to your ears, and that stimulates the vagal nuclei. You can do deep breathing exercises, cold plunges, cold showers, stimulate the vagal nuclei. Those are probably the most common ones, though.
And so those typically help with digestion, might help to reduce some of these like food sensitivities because you're facilitating digestion.
Yep, exactly. Because what you're doing is you're getting the frontal cortex to fire, which then increases your own natural digestive enzymes, increases HCl, increases blood flow to the gut, increases gut motility. It also stimulates what's called an anti-inflammatory cholinergic pathway, which decreases inflammation. So there's a lot of things that kind of help with that. It also puts you into more of a parasympathetic response. And we live these like high stress lives that are really stressful. We're constantly on the go, and we barely even get into a parasympathetic response, which is a rest and digest stage. And so there's a number of really positive things of why we do that. If you incorporate some of these neurological exercises into your daily life, you're going to notice differences for sure.
In your book, you also talk about various environmental factors like cleaning up your home environment.
Yeah.
What's the mechanism there?
Well, we're constantly being exposed to a ton of different things. And I'll preface this. There might be some people that listen to this, maybe not your audience because they're used to all this stuff, but there might be some people that listen to this like, oh my gosh, I can't make all these changes all at once. And I would just preface, just start with one easy change that you can make and then look to improve it. And the same thing goes with your house, right? Where if you go into your home and you're using soap that's full of artificial and synthetic things that are hazardous to your health, just get a more natural soap, right? Or laundry detergent, for example. Get a more natural laundry detergent. Cleaning supplies, you can swap those out. But just find one thing that you can change, do it for a while. When you feel good about it, then you can switch to, you can move on to the next thing in your home. Just even filtered water, for example, taking your shoes off when you come to the house. A number of things like that if you change, you're decreasing your environmental load and your inflammatory load, and you're going to be better off and more resilient long term.
What are the biggest offenders?
Cleaning supplies are probably one of the worst. Laundry detergents is a really big thing. Obviously, anything like a moldy home, if you have a mold in your home, there's nothing that we can do to help you, essentially. Like, you got to get the mold gone as fast as possible, and then we can help kind of build from there. But mold in a home is obviously really bad. Other environmental things like perfumes, laundry detergents, soaps, shampoos, makeups. There's a lot of things that have a significantly high environmental load that impact our quality of life and overall health. And what's interesting too is not everyone reacts to the same thing. So just like food proteins, we'll have different chemicals that will bind onto our proteins called albumin, and then our immune system attacks that and freaks out and causes issues. There's research now that shows if we are exposed to certain things and our immune system starts to attack it, within 5 years, we're almost 100% likely to develop an autoimmune condition. The same thing with gluten. If we have a gluten intolerance and we continue to eat it for 5 years, research shows we're almost 100% likely to develop an autoimmune condition from that. So autoimmune conditions are exploding over the course of the last 40 years. Even for my population, we see a high volume of autoimmune patients. We're seeing younger and younger people with autoimmune conditions and problems just from this, right?
Do you think it has anything to do with our obsession with sterility and hygiene? I mean, it's good to be hygienic, obviously, but there's the hygiene hypothesis, basically.
1,000%, yes. I mean, you look at like COVID, dude. I go to a workout and my bench was just lathered with crap, and I'm like, that's worse for you than
I would rather sit on a bench that has somebody's sweat on it, honestly,
yeah,
than a bench that's still wet from them wiping it down with one of these
we're completely jacking up our
sheets. Yeah,
yeah, you're 100%. We're completely jacking up our microbiome just by those things. We're destroying it from that. So sometimes you're right, where if we're over obsessive about being clean and being sterile, we can actually create more harm than good.
Amen. Yeah, it's the is it like the old friends hypothesis or something? There's essentially that exposure to bacterium, viruses, that they're all that our immune systems learn from those exposures.
Yeah, you're right. Even like having pets, like being around pets, being around things that are a little bit dirty, our immune system actually becomes more prominent and better and more resilient just from those things.
I'm like not at all. I mean, I've never really been, but particularly after becoming more fluent in this literature, I'm definitely not somebody who's obsessed in any way with being like overly hygienic.
Yeah, it's almost just like we're all learning now when it comes to antibiotics. Like I think everyone knows, including your standard conventional doctors, will be like, we can't over-prescribe antibiotics. It's going to mess you up and cause problems with your immune system and your gut, right? There's no difference from that and all things sterile. If we're constantly consuming and wiping our hands with all things sterile and making sure we're in every different way, we're doing the exact same thing that antibiotics are doing to our gut, to our skin, and to our immune system.
And there was a study a couple of years back, I don't know if you saw it, I'm sure you have, where exposure to hand sanitizer before touching store register receipts dramatically increased the absorption of BPA, which is used to coats thermal receipt paper in many retailers.
Yeah.
And so like, not only are you touching those well-known endocrine disruptors and you're getting them all over your skin, and who knows if you're touching your child's face with them or their hands, or you're letting, God forbid, your children hold the store receipts that have that stuff. But then, this obsession with hygiene, like at the front of every supermarket now, you get these like Purell sheets, and that's increasing the absorption of these compounds. And like, a little bit here and there, probably not going to kill you, but
a lot of it, you're going to weaken your immune system and your overall health 100%. There's no questions about it. Yeah. Now, I mean, I have 5 kids too, and we know this, and I've known it for a while, where I'm like, get that crap out of there. Like, you're not wiping your hands. You're not doing any of that stuff. Yes, we'll wash our hands occasionally, but we're not going to over obsess about it, right?
It's a bummer if you're a Costco member. Costco still, you have to hold the receipts to leave the to leave the warehouse or whatever, which is a bummer. Yeah. But yeah, I mean, I think the more people can learn about this stuff, like whenever I always like turn down the receipt. Like, I just don't need it. Like, whatever. The $20 is not worth that much to me if I need to return the product, which is like so rare. Email me the receipt. It's crucially important stuff. And I don't think it's like, do you think it's alarmist? Do you think it's fear-mongering? Or do you think increased awareness, knowledge is power?
Well, I think there's the way that you go about it. It can be either fear-mongering or, we can do it the right way. But for us, I think we do have to kind of put that out there where we have to educate people to know our health and our public's health is significantly declining rapidly. And we know the mechanisms. We know why, right? Out of all 13 developed countries, America is literally dead last when it comes to healthcare. And we're the most expensive by 2 to 3 times the amount. So for us, we need to significantly sound the alarms and educate the population on what to do and what not to do. And there's nothing more horrific than, for me, like if you sat in my shoes and saw the patients that I see every day, you would be horrified, dude. Like one of my patients, her son was asked to draw a picture of her at school, and he drew a picture of her at bed, and he brought it home, and he's like, she pulls it out of his backpack, and she's like, "What's this, Mom?" And he's like, "That's you, because you're always in bed." And she's like, but all of my patients, they literally have fatigue, depression, they don't feel like themselves, and they're told they're crazy or they're lazy, and nobody knows what the heck is wrong with them. And in reality, the mechanism is that we live in this inflammatory chronic crisis, right? We have an inflammatory crisis on our hands in America, and it's time for us to wake up and start teaching and educating patients what to do and what not to do so that they can be a lot better version of themselves. And so I don't want to sound like I'm an alarmist or fear-mongering. It's just what we're seeing every single day. And simple, tiny changes can make a huge impact. We'll have patients that are on 5 to 10 different medications, and they make just a few of these subtle changes, and their quality of life just goes out the roof, right? Like stabilizing glucose, for example. If we just stabilize glucose from 80 to 130, no matter what we ate. So sometimes we'll just put a continuous glucose monitor on our arms, and then no matter what you eat, if you can get your glucose to be 80 to 130, your quality of life and your overall health is going to be significantly better. A lot of our patients, they drop down to 60, and then they go up to 170, and then they drop down to 50, and they go, it's just like this roller coaster throughout the day. But what we eat on a daily basis causes our blood sugar levels to be significantly unstable. And in reality, that just produces a ton of inflammation and problems. Whereas if we just stabilize our blood glucose, just that one simple change, we would feel way better long term, right?
It's so important to have access to a clinician that, is as progressive as you are with these tools, because, like now there's all these like CGMs that are available to consumers, and I posted about CGMs recently, and I got in like rapid succession, back to back, I got a message from somebody, a DM from somebody who was like, I got this CGM and it was like completely inaccurate or whatever. And then the next message that I got like 5 minutes later was like, I slapped a CGM on and it found that I brought the data into my healthcare practitioner, and it found that they had missed pre-diabetes.
Yeah.
Which was wild.
Totally. And you do get the one where you put a CGM on, like 1 out of 20, and it's completely inaccurate. Like it's like sounding the alarms. They're pretty much dead. And you're like, hey, that's wrong. Let's get you a new one and put it on, right? So that does happen every now and then. But it's kind of like a great science project for us, where we put it on and we can see what we're eating, how it impacts our blood sugar levels. And in my opinion, blood sugar levels are one of the most important things that we can do to stabilize, to improve our overall health. That's such an easy thing to do, but it has a significant impact to help us improve there. So if we can just get our glucose to stabilize between 80 to 130, we're rocking and rolling, and inflammation is down. Like if you put on your kids, for example, like you look at what kids eat, they wake up, they have pancakes or cereal. Then they go to school and they have chicken nuggets and milk. Then they go home and they have who knows what. They're on these screens that are completely just frying their brain. What do you think their blood sugar levels are going to be? Like a complete mess, right? And so even for our kids, like we don't fear monger. We want to educate our kids so that they know more about nutrition than most doctors do. We really do. And we'll put the CGM on them, and they love it, and they'll get to see what they eat. And like my son or daughter will eat just absolute garbage on purpose to see what their blood sugar levels do. But they start to realize at a young age, hey, that impacts my blood sugar levels. I'm going to be more cautious. And I know how I feel when my blood sugar levels are high or low or whatnot too, right?
Okay, but to play devil's advocate, I mean, don't you worry that a child wearing a CGM, like they might eat like a handful of blueberries and see their blood sugar spike, and then start to think, oh my God, blueberries are unhealthy.
Here's we eat such crap. So like if they eat a handful of blueberries, their blood sugar levels should never be above 130. They really shouldn't. We're talking like Skittles, which are probably the worst food known to man. Like when it comes to artificial sweeteners,
pure
dyes,
sugar.
I don't think there's a worse food than Skittles. But, they're eating this crap on a consistent basis. If they start to eat real fruit with like a little bit of fiber, their blood sugar levels really won't spike much. And like with our kids, we educate them, we show them what to do, what not to do, but then they kind of like govern themselves. They can eat whatever the heck they want to eat. But for the most part, they feel really, really healthy eating the right foods. Like my one daughter, she's 14 right now. She developed just severe anxiety, and it was really weird. And it kept lasting for almost 2 weeks, to the point like she didn't want to go to school. So I was like, what the heck is going on here? I was like, let's do blood work ASAP. So I did blood work. She had full-blown celiac disease, and we didn't know that.
Whoa.
She stops eating gluten, and instantaneously within a week, her anxiety is gone. But now she's gluten-free, and she cooks all her own stuff, and she knows, we don't tell her she can't eat gluten, but she doesn't because she feels way better eating the right way. And now she's kind of the expert in her own health, feeling great, feeling awesome. And she cooks all sorts of fun, good stuff. But, for me, just being able to educate individuals is really important and empowering to them. And for my daughter's sake, holy cow, dude. Like, had I not known that, she would have had just severe neurobehavioral issues, and it could have infected her, like, her whole life, Yeah,
it's amazing. I mean, it reminds me of those studies that, like, when children are engaged around, like, farming, they're more likely to eat fruits and vegetables.
Yeah.
Because they're taking an active role.
Totally.
So it's like, you inspire kids to take an active role in their health. It
Yeah.
actually stokes curiosity.
It's kind of fun. Like, all of our kids, they cook. I mean, my wife is to credit for all this stuff, but they cook incredible meals. They'll do gluten-free, all sorts of stuff, and healthier options, and it's kind of fun. But even just that, like, most individuals don't realize that celiac disease or gluten intolerance impacts the brain more than it does the intestinal tract. There's a research study that showed only 1 out of 8 individuals who are gluten intolerant actually have intestinal manifestations. for the most part, it destroys neurological tissue and causes neurological inflammation more than it does intestinal inflammation. And so there's a lot of individuals right now who are eating gluten, have severe neurological or behavioral type issues, and don't even realize that gluten in of itself could be the main culprit that's causing inflammation and problems for them, you know?
Yeah, and it's not necessarily that's not necessarily the case for everybody, right? Like
No, but that's something to look for, to where if they end up having like severe anxiety or depression or neurobehavioral type issues, look to see if they have some type of a gluten intolerance, and if they do, pulling them off gluten might be able to significantly impact them. Like I had a patient who had, they called in, we see crazy cases, by the way. So by the time a patient sees us, they've already been to 10 to 20 different doctors and everyone's failed them, right? But so we get calls to see the most insane health cases you could think of all over the world. And I got a case where a mom was like, hey, does Dr. Red see my son who's schizophrenic? And I was like, no way. Like, no way, not a chance, you know? And then I started to do some research on gluten and neurobehavioral stuff. And I kept seeing like schizophrenia and gluten, like research articles like with schizophrenia and gluten. And I was like, hey, call that patient back in. Let's, for fun, just see what's going on with them. And so they found her information after like a few days of searching, and they called her back in. She comes in. We ran all these tests on her son. He ended up having full-blown celiac disease as well, a ton with like a lot of different inflammatory markers, unstable blood sugar levels, just a lot of stuff. And we slowly but surely started to improve it one by one. We removed gluten altogether, and then I got a invitation in the mail that he's getting married. He has like a full-time job. His whole life has completely changed just by decreasing inflammation and identifying what these food triggers were specific to him, right? So it's not the case for everyone, but if you have a neurobehavioral issue and neurological delays or problems, I would 100% run inflammation markers and run, and test for celiac disease, no questions asked.
So interesting. Wow. What are your thoughts on the ketogenic diet? Because I know that they're studying that now in the context of like various mental health outcomes.
I love the keto diet, but in reality, if you look at the keto diet, what are you usually doing? You're avoiding pretty much all the inflammatory foods and processed foods, right? So, but I love the keto diet for specific people. There's some of our female patients, based off of their cycles and based off where they're at, that if they were to fast or go into ketosis, it actually might cause more problems than not. But for the most part, I love the keto diet for sure.
Yeah, I mean, it's keeps blood sugar stable, eliminates, as you said, refined grains.
Yeah.
It's by definition a gluten-free diet.
Yeah. A processed garbage diet, right? You're avoiding all that stuff. You're eating, more healthier foods, less processed foods on a keto diet than anything else.
It's fascinating. Yeah, I don't know if you follow Chris Palmer, but he's the Harvard psychiatrist who's doing a lot of advocacy on behalf of keto diets as therapeutic interventions for schizophrenia, bipolar. Yeah. Super interesting.
There's a lot of incredible research just how diet can significantly change the impact of your brain and how it functions. When you have what's called microglial cells, and these cells kind of act like chihuahuas in your brain, and they kind of go around and clean up debris. If we have brain inflammation, those microglial cells turn into like overactive chihuahuas, and they just chew up the brain and cause a ton of brain inflammation. So we'll have like a professional athlete that gets a concussion, and all of a sudden those microglial cells just start chewing up the brain like crazy. Or we have somebody that eats something that's really inflammatory and is chronically sick and is really inflamed and their brain's inflamed. Those microglial cells start to become overactive and chew up the brain more. But when you do that, it also shuts down neurotransmitters and how they function as well. So just like we're starting to look at psychiatry and brain health as an inflamed brain. There's so many different components where we can calm down brain inflammation, we can calm down the microglial cells, and people with severe neurological disorders or severe psychiatric disorders all of a sudden start to adapt and improve and feel a lot better just by calming down the brain inflammation.
That's amazing. Do you do like imaging, blood biomarkers? Like, how do you measure this stuff?
We do neurological exams. So like we'll have a patient come into our office and we'll do a bunch of different neurological exams to see how their brain's functioning and how it's firing. And then you can also do the blood markers as well. That can be great because if you typically have significantly high inflammation systemically, you're going to have brain inflammation as well.
Yeah, it's interesting. It's like insulin resistance like is very strongly correlated to like reduced metabolism in the brain, hypometabolism in the brain. So it's like, you know, they're not perfect biomarkers because they're correlates essentially, but yeah, I mean, you could learn a lot from blood.
Yeah. So you look at like what we can test from a blood chemistry standpoint, but then us just testing, like doing neurological tests. Like you'd be shocked. I'll show you this video after we're done. But like I saw a really severe patient. She had severe pain in the right side of her head. She was in bed for almost a full year. She went to different neurologists and went from doctor to doctor. And by the time she came to me, like I started to do these neurological exams, like even just heel-to-toe tests, like certain hand things, like just to see which parts of the brain are firing differently, right? And her husband was like, hey, nobody's ever touched her. Like nobody's ever done these exams, which is crazy. She has this neurological issue, and she goes from doctor to doctor. Not one of them actually did a neurological test to see like which parts of the brain weren't firing or what wasn't, right? Which is pretty crazy. And then she had to tape her eye shut because she couldn't voluntarily close her eye. And so it just like stayed open and like, you know, constantly water and have problems and get dry. And so she had to like tape her eye shut. And within 70 days, just putting her on the anti-inflammatory diet, I'll show you the before and afters of like her neurological tests here, doing like heel to toe, for example. She couldn't even initiate it. Just 70 days later, doing it, and she does it stellar. And she's pretty much like a whole different person just by that. But in reality, we put her on the anti-inflammatory diet. We started to do things to get the neurological system to fire differently, just like we talked about. And then, you know, in 70 days, her life was significantly better than what it was previously. And she'd been in bed for literally a full year.
Wow. It's amazing to be a healer in your shoes.
It's awesome. My life is incredible. Like I have so many things at my disposal to help people. And now I do orthopedic stem cell injections with pro athletes. And on top of all my functional medicine training, now you have peptides, you have so many different things that you can do to help an individual improve their quality of life. It's like, it's awesome, man.
Are you seeing good results from stem cell treatments?
Tons. Yeah, incredible stuff. I mean, athletes are a really cool demographic because they're younger. And so somebody might have pull their hamstring, like a Major League Baseball player pulled his hamstring right before the playoffs. And he probably would have been out for 6 weeks, and he was back in 2.5 weeks, just from stem cell injections. Same thing with, somebody like injures their shoulder. They're supposed to be out for 6 weeks. We can inject stem cells, and it just light speeds their return to play, which is really cool. But my medical director does kind of all the injections for our standard patients. We've had a patient who was like pretty much bone on bone, couldn't even walk up a stair, that's now walking 6 miles, doing Pilates, feels great, right? So for the most part, stem cells, it's getting better and better every year. The advancements are getting better and better, and it's really cool.
What are the types of conditions that are at this point like most responsive to stem cell treatments? Like, is it like sports injuries and stuff like that?
Pretty much. Like sports injuries are just joint articulation type problems. So any type of joint injury, soft tissue injury, those are the things that we kind of focus on now more than anything. And the younger a patient is, the more likely they're going to improve and be better off. But when I was at Johns Hopkins, my professor's lab, they could sever a mouse's spine and make it quadriplegic, and then they could inject stem cells and it could fully walk again.
Whoa.
And so I already had like 7 clinics at the time, and I was in that lab, and I was in that class, and I'm looking at all the research, and I'm seeing all the stuff, and I'm like, this is going to change all of healthcare. So from that day, I committed to go back to medical school, went back to medical school, and then did a residency in regenerative medicine. And now I'm doing what I'm doing. But the combo of every single thing that we have at our fingertips to help patients, it's awesome. It's so cool.
Wow.
Yeah.
That's incredible. All right, do you inject the stem cells like via IV or locally?
So our really sick patients that have autoimmune conditions and problems will do stem cell IVs. And a lot of them improve in conjunction with diet, lifestyle, nutrition, all that stuff. It's another tool to help aid in helping them improve. But for the most part, we'll use guided imaging, or we use a C-arm and ultrasound to inject soft tissue, and we use the C-arm to inject like disc, spine, knee joints, shoulder joints, everything that you can think of. The guy that I did my residency with, he does full body stem cell treatments for pretty much celebrities. His name's Harry Adelson. He's a stud. He's kind of the pioneer when it comes to stem cells. He's been doing it for the last 15 years. But he's been doing full body stem cell treatments on celebrities and high profile people, and that's where I did my residency. So we got to learn how to do an injection in pretty much everything. He does all sorts of cool stuff. Discs, every joint in the spine, you name it. But it's really, really cool stuff. We see a lot of great improvements.
Wow, super exciting. I mean, I know I've heard some like really impressive stories. I had a stem cell treatment like 2 years ago, and I had like IV, and then I didn't get stem cells injected into my my disc directly. I had like exosomes and some other stuff like Wharton's jelly. I don't really know what that is, but
umbilical cord stem cells.
Yeah. And didn't help my issue, which was I had a severely degenerated L5S1 disc. So in all transparency, like I did the whole like IV treatment, and then those, whatever those blood products are, like straight into the disc.
You actually had it into the disc?
Yeah.
Where'd you get it done?
Down in Mexico.
Nice.
Yeah,
nice.
but it didn't help.
Didn't work as well as you wanted.
No, it didn't. Yeah, I mean, I was like really optimistic, and I was sold on it, and yeah, it didn't do anything. But I had a really severely degenerated L5S1 disc, and I just don't think that there was any hope at that point.
Yeah.
But also, like, they injected something like I think it was PRP and this Wharton jelly stuff straight into the disc, and I don't know, it might have
no improvement at all.
I had. It felt better in a handful of weeks after the procedure. It did feel better. Like it felt better the next day, the day after, the day after that. Yeah, maybe because it stimulated like an inflammatory like response that was like my body went and sent healing factors.
Totally.
Yeah. But it didn't fix my issue.
Yeah.
Like it didn't grow me a new disc.
For sure. And I think down the road you're going to get that. But in reality, all that we're doing, and everyone's a little bit different, but all that we're doing is that we're injecting these stem cells, and they contain a massive amount of growth factors, cytokines, and regenerative cells, and then that allows your body to kind of go into a healing response to help it improve. If you're degenerative enough, like if someone has a torn ACL or a torn bicep or whatever that is, like stem cells,
it's not magic.
No, with the stuff that I have available right now, it's not going to fix that, right? But there's a lot of cases that if I kind of pick them wisely, they'll improve. And I kind of know like this is a great case for stem cells or this is not a great case for stem cells, right? And so if your disc was pretty much severely degenerative, that may have been why. Or you may just need to use different cells too. Like in America, we can't replicate stem cells over and over and over in a lab. When we do that, like when Mexico does that or other countries do that, as you replicate them, they're becoming less potent too. Like if I'm using 8th generation cells, they're not going to be as effective as the 1st generation cells. In America, we have to use the primary 1st generation cells. We can't grow them in a lab, So you might opt to do something like that. And try it. Do you have a disc replacement or anything?
I did. I had an artificial disc replacement.
You're golden. And
no, it's changed my life.
Yeah. That's incredible. But if it was severe enough, I would have said, get a disc replacement. But also, if you use the primary cells, then you're more likely for it to improve because they're more potent and all that as well.
Do you know others who have had disc replacements?
Yeah.
In their lumbar?
Yeah. Yeah, I have a guy that loves hunting and hiking and all that stuff, and he was almost like incapacitated, and he got a disc replacement, and he's like a maniac again. Like his whole life has changed from it. Yeah.
Do you know who did it?
He went to Europe.
He went to Europe. Yeah. That's where
Where did you go?
Here in LA, a neurosurgeon named Dr. Jared Ament. But
how long have you? So it's been how long?
I've had it for like 10 months.
Nice.
Yeah.
Way better.
Dude, life changing.
That's awesome.
Life changing. I was getting more debilitated by the day.
Dang, that's too bad.
Crazy pain.
Yeah.
And I'd lived with it for 10 years. It was like fairly manageable for most of that time. And then, I mean, honestly, in the year after the stem cell procedure, I don't know if it was because they pierced the disc or if it was just naturally that was the course that it was.
Yeah.
Because it was like really it was like end stage.
Rapidly.
Yeah. It was like end stage. It was like bone on bone. I had edema in the bones, modic changes.
Yeah.
in the bones, and yeah, it was just I had a book fall.
We had a book fall.
Yeah. It was crazy, and I was feeling really deflated and hopeless because fusion just sounded so barbaric to me,
yeah.
and I was like thinking that I was going to have to live the rest of my life like essentially a cripple, you know, and then I became aware of this disc replacement procedure. And I was terrified, but I went through with it because, you know, they go in through the front. It's like, it sounds like really barbaric.
Yeah.
But oh my God, it's like, and knock on wood, because, you know, it's a mechanical device. I hope it doesn't fail. I definitely, I'm very smart about it. I'm very careful, but I like to lift weights, and, you know, so I just hope it maintains. But yeah, I mean, I would do it 1,000 times over.
That's so great.
I would pay 100 times what I paid for it.
Yeah.
Because even just the past 10 months, it's been incredible. I can
imagine. There's nothing worse than low back pain too. And when your disc is bad enough and you have bone on bone there, it just makes it so bad to function for sure. Disc replacement is definitely the way to go if you're going to have some type of back surgery for sure. And the advancements of disc replacements are getting better and better too. So even in 10 years from now, you could go back and get it redone, and it's going to be even better, right?
That's the hope. Because right now, like, revision surgery is like allegedly you don't really want to do it. It's risky, but maybe 10 years from now, who knows?
It'll be significantly better. They have a lot better techniques in other countries too. But even for me, I broke my back and was paralyzed for a few days, and then was in bed for 6 weeks. I was pranking I love pranks, by the way. I was pranking my family. I went to go jump out of the window, and I was going to run around and pound on the window when they're watching a scary movie. And where I jumped, I didn't know that it was ice, and I slipped and landed and just slammed my butt into the ground, shattered my tailbone, and then broke 3 vertebrae.
No.
And I love golf. And so, like, I could, like, even after the year, I couldn't sit down for more than an hour. I couldn't golf. Like, it was so back pain. You and I got a lot in common there. And then I was in the middle of my stem cell stuff, like school, and I was like, I'm going into this. I might as well just test it out and try it. And like, it significantly helped me. But
that's amazing.
It's not for everyone, right? And we're kind of super transparent when it comes to that. Like, for some reason, there's 20% of the people that we inject and help that they don't improve, and we have no idea why. There's 80% that improve and do awesome, and then there's like 50% that for some reason get results that are awesome, you know?
Wow.
But it's going to advance. It's just getting better. But same with disc replacements and all that stuff as well.
Well, yeah, that's an amazing clinician right there. Is like somebody who doesn't just like try to sell procedure, but it tailors the treatment to the patient. Totally.
Now you have peptides. Throw that on the mix of helping with inflammation, helping with pain, helping with all that stuff, angiogenesis and everything there too. We have so many different tools right now that we can use to help people for sure.
Yeah, getting this disc replacement, my legs have never been stronger. I'm like enjoying leg day now for the first time ever. No, it's like a really wild thing. I've been like spamming my Instagram followers with like, you know, stories of me like doing leg presses, because for a decade I've felt disconnected essentially from my lower body because I had this sharp pain right in the center of my body.
Yeah, 1,000%.
So like there was like this disconnect between my lower body, my upper body. I couldn't really train my lower body. And now I have this like incredible sensation of, for lack of a better term, wholeness, where, you know, it's awesome. My legs are getting stronger. I'm, for the first time ever, enjoying working them out. It's
that's great.
Yeah, it's wild.
When did you notice the first difference after your injection? After your replacement? Like how long did it take before you realized this is awesome?
Immediately. I woke up from surgery and the back pain was gone.
Wow.
Yeah. I had incision pain in my stomach.
Yeah.
Anytime I would laugh, you know, I would feel like I was getting like stabbed in the gut. And I sleep on my stomach, so that was kind of uncomfortable. Like first night I slept on my stomach, otherwise I couldn't sleep.
Yeah.
So like it's a weird sensation, definitely not comfortable, and my stomach was bloated and distended.
Yeah.
But that like sort of mid-back sharp pain that I had for so long was just like gone.
For the first time those nerves had a break where they weren't getting impinged, man. That's crazy.
Exactly. I would get a ton of referred pain in my like just above my right butt cheek, like in that hip area.
Yeah.
Which wasn't because there was damage there. It was just like the nerves going.
Referred pain from the nerve of your low back.
Yeah, I guess, yeah. And yeah, it's just incredible.
That's great.
It's amazing.
I'm
it's
glad
like a
about
blessing.
It. I'm glad. Yeah, that's huge.
So what can people expect in 30 days? The 30-day inflammatory reset. Again, it's a beautiful book, and you got tons of information. It's like a 2-in-1. You got like a wellness guide situation going on, and you've got these beautiful full color photo recipes.
Yeah, that's kind of the cool thing is it is 2 books in one. It has like first part is a bunch of literature and research and all the top things there where we kind of go through what inflammation is, how to test for it, how to treat it, how to identify it, how to work with it. And then we have kind of where we hold your hand and have this map on what to follow to improve for 30 days too. But in reality, a lot of our individuals, like I said before, they might have 5 good days a month. And our goal is to get to where you have more good days than bad days. Like, I feel really confident for the most part, this book, as you follow it, will significantly lower inflammation and improve your quality of life long term, but also give you the tool to know how food impacts your quality of life. There's tons of people out there that go to doctor to doctor to doctor that get put on medications, and not once is diet mentioned, right? That's crazy to me. So this will help educate you to know how food is impacting your quality of life and your overall health. And it's pretty dang simple. Like, give us 30 days, work incredibly hard, and see what it does, right?
I love it, man. Well, congrats.
Yeah, thanks for having me. This was awesome.
So fun.
Yeah.
Great getting to know you.
Do we mention the maps thing?
The maps when you were coming to the studio? When you were coming, you thought you were entering like the Saw dungeon. Yeah.
On maps, I kind of looked and it popped up a photo of where I was going, and the house looks incredibly scary. And so I was like, oh my gosh, I'm going to get killed when I go to this podcast. But the house, it's not even the same house. It's like incredibly nice house. I love it. It's good.
Thank you, brother. Yeah. It's the power of a good remodel.
Yeah. Yeah, absolutely.
Well, thanks for coming out. Appreciate you. I've got one last question for you. Before we get to that, where can listeners pick up your book, and where can they find you on social media? How can they connect?
Yeah, so they can go to the inflammatoryreset.com, and you can buy it there. And then I'm at Dr. Josh Red on pretty much everything. So
love it, brother.
Yeah.
What does living a genius life mean to you?
That's a good question. I didn't know I needed to answer this question. You should have told me in advance,
Go philosophical.
Yeah. So say that again.
What does living a genius life mean to you? When you envision a life well lived, a life that you might describe as a genius life.
That's a great question. For me, I have 12 years of postgraduate school. I have all these different accolades and all these different things. And in reality, it doesn't really mean much to me. Whereas I have the people close to me, my wife, my kids, time with them. I'm realizing now that's more valuable than anything that I ever have from, a temporal state, I guess you could say. Any accolade, anything that I've ever accomplished, anything that I do doesn't even come close to comparing to being a good father, being a good husband, and doing the best I can to raise great kids and help teach them and help them and kind of be there for them. So a genius life for me is a guy that has time for his family and loves and cares about those individuals, the people that he's closest with, right?
I love that, dude. Beautifully put.
Yeah.
Thanks for coming out.
Yeah, thanks for having me. Appreciate it.
Thank you guys, of course. Thanks for listening. Share this episode with friends and loved ones that may benefit from it. And don't go crazy with the gargling or the gagging because, do what you want. Peace. Hey, if you liked that video, you need to check out this one here, and I'll see you there.